Hello everyone, welcome back to my channel. If you're new here, hi, my name is Charlotte. I'm a registered nurse and a graduate of AUT. I sat the States exam last November and I'm here to help you study and prepare for the States. So the New Zealand Nursing Council state examination is the big exam that you will sit on completion of your Bachelor's of Nursing degree, and you sit it in order to be able to get your registration and practice as a nurse in New Zealand. So I did make a video about everything that you need to know about the state's examination, so if you want to check that one out, I will link it in the description box below, and also a little banner should have popped up here which will take you directly to it. Before we get into everything, don't forget to like, subscribe, do all of that good stuff, but for now let's dive right in. So first things first is how long should you start studying before the state's exam in order to do well in it, and for how long each day should you study for. So me personally, and for a lot of my friends too, we started studying 1 month before the state's exam. I started right after I had finished my final placement, just so that I wasn't stressing about finishing assessments and then also studying, and it just meant that when I started studying for the States I could focus my full attention on it. I would study between 1 to 3 hours a day, but I'll also be honest, there were a couple of days and some days consecutively where I didn't do much or anything at all really, because I thought I was unmotivated or I had very little energy to do so, and I still managed to pass. So my point is that it just depends on what best for you. For me, starting 1 month before and then doing 1 to 3 hours a day worked for me and really helped me balance everything from working to studying and having somewhat of a social life. So I think that the best thing that you can do is to start at least 1 month before and then do at least 1 to 3 hours a day. But again, everybody is different. Some people really like to cram a week before the exam, other people like to start months before, some people will do maybe half an hour of studying and be okay with that, other people may do hours and hours, some people will alternate their study days, some people will keep their weekends free. So it just depends on what your schedule and your routine is and how much you can do without burning yourself out. So we know that the state's exam is an online multiple choice exam of 120 questions for registered nurses and 90 questions for enrolled nurses. So this means that one of the things that you're going to have to do if you want to go in feeling confident and prepared and feel comfortable taking this format of exam is doing practice exam and questions, specifically practice multiple choice exams, because the main thing that you will want to exercise is your test taking skills. At this stage you already have the knowledge, you already know your pathophysiology, your drug calculations, your pharmacology, you have this knowledge within you. So in the month leading up to the exam, you're just going to be refreshing everything and exercising your exam taking skills. In the exam you have roughly 1 minute per question, so by doing practice exams and questions you're also teaching yourself how to work through questions quickly, so that in the real thing you're not rushing and you have time left over to be able to go through everything and make sure that you're happy with your answers. We'll also teach you how to pick the most correct answer out of 4 different options. So in the exam, my top tip is to first rule out the options that you know are definitely incorrect, and then looking at the remaining options and either selecting the one that you know to be the most reasonable, safe for the patient and likely to be correct, or if you're really stumped, then you have less options to choose from to just guess. If you get rid of the incorrect options first and then have to guess, you've got more of a chance of it being correct than if you were stuck with all of the options. Another top tip for the state's exam is to answer every single question, even if you're completely unsure or don't know the answer, because an incorrect answer is definitely going to be incorrect, whereas a guess has a 25% chance of being right. So where do you get these practice exams from? So unfortunately, the thing about the New Zealand Nursing Council is they are very secretive about the state's exam, and they will not release practice questions or past exams for us to study and go over. So this means that we don't have many reliable resources for us to use in order to prepare for the exam. However, me and my friends found that we passed the exam just fine by using the following resources. So the first one is the Nurse Labs website, which has a lot of practice NCLEX and drug calculation questions and question banks. So the NCLEX is the American Nursing Exam, and it is notoriously more difficult than the States exam, and they also have select all the apply options, which we don't have in the States exam. However, I found that by using the more difficult NCLEX practice questions, I did feel feel more confident about walking into the exam room, and also the questions that I ended up getting in the states exam were a lot easier than the ones I had been practicing with. So I would highly recommend Nurse Labs. I will link this and every other website and resource that I use just in the description box so you can kind of peruse through them at your own leisure. The other place that you can go to is Quizlet, because it has a lot of practice questions and they were created by previous students who have compiled them together for you to use. And the other place that I would really recommend going to and joining is the New Zealand States Exam Facebook page, because this is a group which has past and previous students who will post practice questions from states exam workshops and online practice exams. And also they will try and remember questions from previous states exams that they have sat, and they will upload it onto the Facebook page so that you can go through them, practice the questions, and then also discuss everything with the other Facebook group members. So I use that a lot and I found it really helpful. I also personally use Lecturio a whole bunch because they have the spaced repetition flashcards which helps reinforce my prior knowledge, and they also have the exam pathways, the little lecture videos for studying, and they also have the option to do practice exams, which I find really helpful. Lecturio just has everything, and if you've seen some of my videos you'll know that I go on about them a lot, but it's just because I really do recommend getting Lecturio. If you are just getting it for the states exam, I wouldn't recommend it because it is a bit expensive, but if you are at the start of your nursing school journey or beginning your final year and you're just watching this video to kind of prepare for, you know, the end goal, then I would definitely consider getting Lecturio because it will help you throughout nursing school. Lecturio is another thing that I used a lot, but that was because I already had a subscription to it. Finally, the Nursing Council website does have one single practice exam which you can use. There are no answers to the questions, so it's a little bit of a waste of time. However, if you want to get an idea of what the states exam questions are like and how they're worded, then checking out that exam on the website is really helpful to kind of give you an idea of what you'll be walking into. So I would recommend just having a look at that just so that you kind of get an idea of what to expect a little bit from the questions. So those are the main resources that I used, and then one thing that I would really recommend doing to kind of complement that study is to have a little notebook which you can use to jot down any questions that you get incorrect or any topics that you find that you're still a bit rusty on or need some refreshing over. I did this and it was really helpful in directing my revision sessions because I knew which topics I actually had to go over. For example, I was really rusty with my lab values and there was a possibility that those could come up in the exam. Moving on to the next thing that I recommend that you do, and that is states exam workshops if your uni puts them on for you. My university, AUT, organised 4 state exam workshops for us. There was one a week leading up to the states exam, and they also had a practice mock exam 1 week before the states, and it was just an opportunity for us to get together and practice different drug calculation questions and practice questions which were grouped into different body systems. So for example, 1 week we went over respiratory system questions, the other week we went over cardiovascular questions, and each week we did drug calc practice as well. And then after we had done all the questions, we had the opportunity to discuss with our peers why we thought something was incorrect or correct, and just kind of share resources. It was really helpful as well. So if your university puts on states exam workshops, definitely make the use of your time and go to them because they are helpful. So I mentioned earlier that there's not very many resources that you can use if you are studying for the states. However, the organised nurse does have a states exam package, and it's full of worksheets and topic sheets, a weekly planner. It's got all sorts of little stuff in it. I didn't get this and we didn't purchase anything to help us pass the exam. However, if you are somebody who really likes worksheets and topic reviews and you're not worried about paying a little bit of money in order to get these, then definitely check out the organised nurse states exam package. So moving on to topics to study. One thing about the states is that they have a broad range of topics, so it's really difficult to know specifically what to go over. However, the things that I've kind of compiled are the stuff that I I studied and found helpful, or things that ended up popping up in the exam. So the first thing was the drug calculations, because you need to practice these in order to be a good and safe nurse anyway, but also because 10% of the state's exam questions are drug calculations, it is important that you practice these and just stay on top of that knowledge. The second thing is Te Tirotio Waitangi and its principles, because a big part of cultural safety comes from Te Tirotio Waitangi. The other thing is the Privacy Act 2020 and the Health and Disability Commissioner Act 1994, and any other little legal kind of ethical documents which come up a lot within nursing practice. It's good just to kind of go over them, as well as the Nursing Code of Conduct. So the state's exam is run by the Nursing Council, and a big thing for them is your code of conduct. The thing that I did that I found really helpful, because I noticed that some of the questions that I was getting wrong in the practice exams were because I didn't understand what some of the options were and stuff, just because I wasn't familiar with the vocabulary. So searching up medical terminology flashcards on Quizlet or Anki or wherever you go to for your flashcards is also really, really helpful. Basic anatomy and physiology review if you need it or want it, just so that you can remember how everything works, and also work through questions if you are stuck on something. One thing that you should definitely be revising is maternal nursing. We got a couple of questions about our pregnant patients and things like nutrition, or we had a question about folic acid in our state's exam. So maternal nursing is an important one to study, and kind of following on from that, basic nutrition and diet, especially regarding pregnancy. Pediatric nursing, such as vaccinations, infectious diseases and stages of development. However, I wouldn't put too much effort into revising this in depth, just doing it enough so that things are just a little bit refreshed, and just a quick review so that you're familiar if anything pops up. Another big one to study is diabetes, especially in New Zealand because it is so prevalent here. And then mental health and conditions such as dementia, Alzheimer's and Parkinson's. Again, just do quick reviews, don't go too in depth into it, you just want to refresh your prior knowledge. And then finally, because the questions are so broad and they can ask you anything, I would study a broad range of Gen Med and Gen Surg topics, things like COPD, asthma, myocardial infarction, stroke, TBI, pre and post-surgery checklist, broken bones, all of that jazz. So yeah, that is everything that I would review and revise for in preparation for the states. You will have to accept that there are going to be one or two curveball questions which you are not going to know and will be completely stumped on, and you're just going to have to guess them, and that is okay. You also have to know that you have gotten this far because you are smart, capable and able to achieve. You've got this far for a reason. This is the last little hurdle towards becoming a registered or an enrolled nurse, and you have got this. And if in the event that you don't pass the first time round, just know that yes, it's going to be upsetting, and yes, it will be frustrating, but it's not the end of the world and you can resit the exam. I have complete faith in you, and I believe wholeheartedly that you are going to be an incredible nurse. You deserve this, you've worked hard for this, and you're almost there. Just keep going, you'll get over that last little obstacle and then you'll have made it. So just remember to take a deep breath, make some time for you to relax as much as possible, and just go into the exam knowing that you've done everything that you can and it will all be okay. Anyway, that was today's video. I really hope that you found it helpful. If you are somebody who has already sat the states and you have some resources or advice for our fellow students who are about to sit it, please share it in the comments, because sharing is caring and we want to lift each other up. Before you go, don't forget to like, subscribe, do all of that good stuff. I'll see you next Monday with a new video, but until then, have a lovely day and a fabulous week. Bye!
It's rated X. That means you're extra.